Good morning, everybody. We'll get started here. It's just about 11 o'clock. My name is Jennifer Hope, and I am the Director of Marketing at ARTA. And today I'm going to talk to you about ARTA and the ARTA benefit plans. Some of you might already be members, so this just might be a refresher on what you get with your ARTA benefits plan. Some of you might be thinking about joining ARTA and the ARTA benefits plan, so hopefully this presentation offers some more information for everybody here. So, because ARTA is all walks of life, we are all ARTA. Sometimes people who aren't teachers say, why am I at the Alberta Retired Teachers Association presentation? We have two sectors. We have an education sector as well as a public-private sector. And our education sector has regular and affiliate education sector members. So regular education sector members are those who have contributed to the ATRF for 5 or more years, and our affiliate education sector members are members who work at post-secondary institutes, whether it's a college or a technical institute or a university. As long as it is an accredited post-secondary education institute, you are eligible to join our education sector. And then we have our public-private sector, where we have our public sector is where our members who have contributed to a government-sponsored pension plan, or you're in our private sector where you have special eligibility criteria that you have met. So we are all ARTA. We have teachers, nurses, doctors, accountants, engineers, many different walks of life within our benefits plan. And all these people hold the same type of insurance risk as a retired teacher would. We are a closed benefits plan, so not everybody is eligible to join ARTA. So if you are eligible to join ARTA, that's great. And if you have questions about your eligibility, you can send that question in later on. Speaking of questions, if you have any questions throughout the presentation, please use the Q&A function in Zoom, and I will get back to you. I'll answer the question as the presentation goes on, or I will wait to the end to answer those questions. So again, when talking about ARTA's eligibility, there are requirements that you have to meet. So that education sector or public-private sector, public sector, if you're vested, receive a pension plan, a government-sponsored pension plan, education sector, if you're in that if you have contributed to the ATRF. Some other eligibility requirements, you need to be an ARTA member. So there is a fee to becoming an ARTA member, and our education sector, that's $25 a year, and our public-private sector is $50 a year. And with that ARTA membership, you are gaining access to join one of the ARTA benefit plans, as well as one of our really great membership advantages. We have a scholarship program, so we award 8 $5,000 scholarships annually to our members' direct relatives, so any children, grandchildren, nieces, or nephews. We have a scholarship program where our members' direct relatives can submit their application to, and our scholarship committee could potentially choose your direct relative. We also have some really great wellness activities that we host throughout the year. We have a wellness walk that a bunch of our members around the province get together and do a walk. We have socialization opportunities within our branches. We have a photo contest every year. We have a writing contest every year. So just some really great programs that our members can join to kind of stay engaged in retirement. We actually just offered our members a free movie. So we played It's a Wonderful Life at 8 different theaters across the province, and our members got to come and watch a free movie with popcorn and pop. So just some really great additional advantages when you join ARTA. We also have a really great discount program, which I'll talk about in a couple slides here. So you need to be a Canadian resident covered by your provincial or territorial health insurance plan within your province of residence. Maybe you're from Alberta and you retire in Alberta, but you have family that lives on the East Coast, or you want to retreat to some warmer climates in BC. That's great. You can do that. Your ARTA benefits plan will follow you. We have members throughout the country. The only province where the ARTA benefits plan will not follow you to is Quebec, as their provincial healthcare plan does not work in tandem with the ARTA benefits plan. You can join ARTA at any age, and you can remain on the plan until any age. So there's no age restrictions, even within our emergency travel coverage. There are some plans out there that will terminate you at the age of 85. We love seeing our members that travel well into their 80s. So your plan will not be terminated at a certain age. Your eligible dependents can join ARTA as well as a surviving spouse. So if you are eligible to join ARTA today, and if something were to happen to you, your spouse can join ARTA, or maybe you and your spouse join an ARTA benefits plan and you're the primary card holder. And if something were to happen to you, your spouse can continue on with their ARTA benefits. We will not terminate any surviving spouses. So our benefits plan, I'm assuming the main reason you guys are all here today. So just a bit of a background of the ARTA Benefits Plan. The ARTA Benefits Plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. When you retire, most people are looking forward to traveling, maybe not, but when you can travel in retirement, you're no longer bounded by your vacation time. You don't need to. You're no longer bounded by the school year. You can go whenever you want. You can go for how long you want. So the ARTA benefit plans offer some really great emergency travel coverage. We do not have any stability clauses for pre-existing conditions built into our benefit plans. A lot of plans require that you're stable for 90 to I've even seen 365 days. So, and I'll talk about that in a couple slides here. So we are a not-for-profit organization as well. So any dollar that comes into ARTA goes back to administrating the plan, back to making sure that we're offering the best benefit plans possible for our members. There are some plans out there that will offer you a discount of say 10, 15% if you join during a certain period of time. We don't offer those discounts because we don't have any of those profit margins built into our monthly premiums as we are a not-for-profit organization. So applying to ARTA. Applying to ARTA is really easy. If you know that you are going to be retiring and you are going to be losing your employer-sponsored benefits, I typically suggest to people get your application into ARTA about 4 to 6 weeks before losing your current group coverage. It's really easy to do. You can do it right online. If you are a teacher, I would say it's a good spring break activity, or maybe if you are at a post-secondary education institute, maybe reading week is a good week to take a look at that. And you can send your application in as early as you want, and your ARTA benefits will start on the first day after you lose coverage with your employer sponsored benefit plan. However, it is really important to get your application in within 60 days of losing your employer-sponsored benefits if you want a plan that includes emergency travel coverage. Because if you apply outside of that 60-day window, you would need to fill out a medical questionnaire. And that medical questionnaire is administered by our emergency travel partner, Beneva. So depending on your health, you may or may not be accepted into that emergency travel plan. So get your application in early. You don't need to worry about it. And that 60 days is after you lose your employer-sponsored benefits. So maybe you are going to lose your employer-sponsored benefits in June. Don't wait 60 days after that time of losing your benefits to apply to ARTA. It's not 60 days before. We do know that a lot of people do their spouses continue to work when they do retire. And if your spouse is continuing to work and they are getting benefits and you can remain a dependent on that plan, that's great. You can have their employer help pay for your benefits, but when your spouse loses your benefits, make sure that you apply within that 60-day window of you or your spouse losing those benefits. So now I'm going to talk about the different plan options that we have available. So we have two kind of buckets of plans available. We have our comprehensive plans, which are available for our members under the age of 65. We created these plans for members under the age of 65 because you're not eligible for that Alberta Coverage for Seniors plan yet. When you do turn 65, you are eligible to join the Alberta Coverage for Seniors plan. And the Alberta Coverage for Seniors plan will pay for 70% of prescription drugs listed on the Alberta Drug Benefit List, and then you're on the hook for that remaining 30% up to a $25 co-payment. So when you have the ARTA Benefits Plan and the Alberta Coverage for Seniors Plan when you turn 65, and you coordinate those two plans, your prescription drugs will be covered at 100% of drugs listed on that Alberta Drug Benefit List. And that Alberta Drug Benefit List covers hundreds of different prescriptions. But our comprehensive plans, these plans offer some higher prescription drug maximums, travel coverage, and dental. And our build your own plans, these plans, they were kind of built to work directly in tandem with that Alberta Coverage for Seniors plan. However, you can join those plans at any age. But first, I'm going to go into detail for our comprehensive plans. So our comprehensive plans offers three different levels of coverage. Core health being that basic, essential health, that middle of the road, and enhanced health has some higher annual maximums. All of our benefit plans include single, couple, and family care coverage. And with all of our benefits plans, you're always able to move up in coverage. But once you've moved up in coverage, you are locked in for 24 months. So you might want to start at core health and maybe something happens and you need some higher prescription drug maximums. You can always move up to that higher level of coverage. But once you've moved up, you are locked in for 24 months. All of our plans, the annual maximums are per covered person. So if you and your spouse join the plan, you each receive that annual maximum. I'm going to talk about a couple benefits that are covered within our comprehensive plans, but please note that we cover a long list of different benefits, many different medical aids and supplies, vision, hearing, coverage, CPAP machines, private duty nursing, wheelchairs, many different items. We would just be here all day if I went through every single benefit. So I just wanted to highlight a couple here. So the overall coverage level in our comprehensive plans is 100% unless otherwise indicated. So if you submit a claim, you'll be paid out at 100%. The overall annual maximum ranges from $10,000 all the way up to $15,000. So what that means, that just means that's the amount of money that we will pay back to you within a calendar year. And rarely does anyone actually hit that annual maximum. Just sometimes people are just confused by the wording. Prescription drugs are covered at 80%, ranging from $1,500 all the way up to $5,000. You might not know how much money you've been spending on prescription drugs throughout your career because your employer has been helping you cover those prescriptions. So I typically suggest to people, maybe go visit your pharmacist, then they can give you an average of how much you've been spending on prescription drugs throughout the years. Then you can make an educated guess on which plan might work best for you and your family. Paramedical services are covered at 80%, ranging from $750 a year to $1,500 a year. And the ARTA paramedical service coverage is a little bit different from other plans. We offer an annual combined maximum. So some people only like getting massages. That's great. You can use that entire maximum on a massage if you want. Or maybe you want to spend $800 on counseling and then you'll have $200 left over for whatever practitioner you want. We want our members to be able to use that annual maximum on the practitioner they need when they need it. A lot of plans will say you have $200 for massage, $200 for chiro, $200 for physio. We want that annual maximum to be used for our members' needs when they want it. Diabetic supplies are covered at $1,750 a year. So this is a bit different as well for some plans. Some plans, diabetic supplies roll into their prescription drug maximum. Our insulin-dependent diabetics have $1,750 a year to use on diabetic supplies, such as those Freestyle Libres and the Lancets that go in there. Comprehensive plans do include our 92-day emergency travel coverage with no stability clauses for pre-existing conditions, as well as supplemental travel coverage, which I'll talk about in a couple slides here. Comprehensive plans also include some dental care coverage, so 80% coverage for basic, preventative, and minor restorative work, And our enhanced health plan offers 50% coverage for any major restorative work. So your crowns, implants, onlays, all that nasty dental work. We also offer 50% coverage for orthodontics up to a $2,000 lifetime maximum for any eligible dependents. So in summary, our comprehensive plans are available for members under the age of 65. They offer coverage for a little bit of everything with some higher prescription drug maximums. So now I'm going to talk about our build your own plans. So our build your own plans originally were built to work in tandem with that Alberta coverage for seniors plan. So you are required to choose a prescription drug maximum. Sorry, this is a typo. Under prescription drug maximums, you do receive $1,500. You have to choose $1,500 or $2,500 a year for prescription drugs. But again, if you have that Alberta coverage for seniors plan, I do see that there are some people that are not from Alberta here. So your seniors plan in your province would also be the first payer in prescription drugs. ARTA would become the second payer in prescription drugs. So when you coordinate those two plans, your prescription drugs will be covered at 100%. So that annual maximum can stretch a really long way. And again, you're always able to move up in coverage, but once you've moved up in coverage, you are locked in for 24 months. So with our build your own plans, you can join one of these plans at any age. So we kind of allow our members to pick and choose what they want in a benefits plan. So they can choose their prescription drug maximum. We offer two plans that do not include emergency travel coverage, HealthWise and HealthWise Plus, and two plans that do include emergency travel coverage, Total Health and Ultimate Health. So maybe you're someone who doesn't want to travel, you can choose one of our plans that do not have emergency travel coverage. And HealthWise Plus and Ultimate Health, these plans have some higher annual maximums for vision care, hearing aids, paramedical services, and it also offers some coverage for defined lifestyle medications, such as erectile dysfunction and hair loss medications. Weight loss medications were considered a defined lifestyle medication, but now with the growing popularity and how much they have been helping people, these can be covered under your prescription drug maximum with special authorization. So again, with our build your own plans, we cover a long list of different benefits. Paramedical services, that combined annual maximum, single, couple, family care coverage within these plans as well. And you're always able to move up in coverage, but once you've moved up, you're locked in for that 24 months. And with our build your own plans do not include dental care coverage. So we offer 3 standalone dental care plans, option A, B, or C. Option A being the most comprehensive with 80% coverage for basic, preventative, and minor restorative work, and 50% coverage for major restorative work. And option B just doesn't include that major restorative work, and option C includes 65% coverage for basic, preventative, and minor restorative work. You can add dental when you join a build your own plan. You can add it later on down the road. It's entirely up to you. And again, single, couple, family care coverage plans, and you're always able to move up in coverage, but once you've moved up, you're locked in for that 24 months. So if you are taking part in one of our plans that includes emergency travel coverage, so one of our comprehensive plans or Total Health or Ultimate Health, you're gaining access to some of the best emergency travel coverage there is in the country. I say that again because we do not have those stability clauses for pre-existing conditions. So for example, if you have a trip planned and you go visit your doctor and you have a change in medication, maybe an increase in dosage or a decrease in dosage, or maybe there is a change to your health care, both you and your doctor feel that you're well enough to travel, go travel. And if something were to happen because of that prior change in medication or the prior change in your healthcare, you will be covered for it as it would be considered sudden and unforeseen. As long as both you and your doctor feel that there is no cause for concern, go travel, enjoy it, and if something were to happen to you, you will be covered. So when you do travel outside of your province of residence, you are covered for any 92-day trips up to a $5 million per trip maximum. And you are covered for any 92-day trips you take outside of your province of residence. We know a lot of our members like to snowbird in places like Palm Springs or Phoenix, or maybe not right now, or they're taking trips that are longer than 92 days. That's great. So we offer supplemental travel coverage in 15-day increments, all the way up to 212 days. It's always better to have that supplemental travel coverage before you go away. However, if you're on a beach in Mexico, you see it as -40 in Alberta, you're within your 92 days and you haven't made a claim, you can call ARTA and add any 15-day increments you would like onto your emergency travel coverage. There is a fee to the supplemental travel coverage. So what some of our members do is they find a cheap flight back to their province of residence, hold on to proof that they did cross back with a coffee or a boarding pass, or if you're driving, maybe your receipt from McDonald's in Alberta. So if you do cross back, you can cross right back into the sunshine and enjoy another 92 days. You're not required to be within your province of residence for a certain period of time. Another great bonus of the ARTA emergency travel coverage is we offer trip cancellation and interruption insurance. So we offer $10,000 per person per incident. So perhaps you have a trip planned and you fall ill, or maybe your travel partner falls ill, or maybe you are away and you need to interrupt your trip to take care of a loved one. Maybe your home suffers a flood or a fire. You can use that $10,000 trip cancellation and interruption insurance to pay for any additional fees that you might have to incur. And again, the ARTA emergency travel coverage does not have any termination ages. So when you are looking at different plans, make sure you're looking at those termination ages, because sometimes plans will terminate you at the age of 85. So when you do join ARTA, you will gain access to some really great additional resources. We have partnered with Green Shield Health, and they offer our members virtual physician services with telemedicine. Maybe you need to get into a doctor right away, and you can't get in, you can't get an appointment, or maybe their office is closed. You can pick up a phone and a licensed Canadian physician will answer the phone, and they will answer any questions that you might have that's going on with your health, and they will be able to provide you a prescription as well. So just a really great opportunity for our members to see a doctor when they need it. We also offer virtual health services and counseling. So all of our members receive 5 hours of free counseling, as well as 5 hours of free couples counseling every year. So again, just some really great additional resources for our benefit plan members. We also have a really great discount program. So about 2 years ago, we brought our discount program in-house, and we called hundreds of different businesses that we thought that our members would enjoy getting discounts at. So we have well over 100 ARTA Perks discount programs that offer our members discounts on hotels, restaurants, retail outlets, airport parking, Broadway across Canada, many different places to get a discount from. So if you use your ARTA Perks discount card once or twice, your membership will have had paid for itself. I know I use my ARTA Perks discount card more often than I should, but I have saved quite a bit of money. So when you do join ARTA, you will be asked to create a My ARTA account. And within that My ARTA account, you will get access to the My ARTA Health Hub. And the My ARTA Health Hub is a really great place where you can submit any claims. Perhaps maybe there was no direct billing at your massage therapist or dentist or whatever it is. If there was no direct billing, you can submit your claim online and be reimbursed within 24 to 48 hours. You'll also be able to check your coverage levels there, see how much money you have left in your paramedical, see how much money you have left in your prescription drug coverage. So just a really great tool for our members to manage their benefits. And the My ARTA Health Hub is also available in an app. So I know I talked about a lot today. There's a lot to think about. So we have a really great website, artabenefits.net. And artabenefits.net offers a really great build your benefit plan tool. So if you click on the build your benefit plan tool, this tool asks you a series of questions, whether you're over 65, under 65, if you want travel, if you want dental. And from those questions that you answered, A chart will populate with all of the plans available to you as well as those monthly premiums. You can also find the monthly premiums on artabenefits.net. If you are an education sector member, so a regular education sector member or an affiliate education sector member, you use the education sector rate sheet. And if you are in our public and private sector, you look at the public-private sector rate sheet. And so once you decide what plan you would like on with ARTA, you can ultimately apply online. I also just wanted to mention two more benefit plans that are available to our members who live within the greater Edmonton area. We have a pharmacy ARTA RX, and we have two benefit plans that work in tandem with that pharmacy. Currently, those plans are only available for members who live within the greater Edmonton area, but we are opening a pharmacy in Calgary in the new year. So soon our Calgary and area members will be able to join one of those two benefit plans as well. And you can find more information about ARTA RX at artarx.net or on artabenefits.net. That's all I had to present to you today. I do see some questions in the Q&A section in Zoom here, so I will get to those. However, if you would like us to send you an enrollment kit, you can email join@arta.net and we will get an enrollment kit out to you. And that kit has a plan options brochure which outlines all the benefit plans available. It will also have a rate sheet as well as some great retirement advice. So just email join@arta.net for an enrollment kit. Or if you have any questions, you can also email join@arta.net. But later on down the road, if you're thinking about joining ARTA, or if you want to come into our Edmonton or Calgary offices and sit down with a member services team member, you can email info@arta.net. But yeah, you're always able to come visit us. Our office in Edmonton is located on 137th and 155th. And our Calgary office is just located on the northwest, just off the Deerfoot Trail. So yeah, I will answer any questions that come in, but if you don't have any additional questions for me today, thank you for joining me. I will post this webinar on our YouTube channel. So if you visit YouTube and type in the ARTA channel, you can rewatch this video or share with any friends that you might have. But I'll get to answering the questions. There is a question, do you need to live in Alberta to be eligible? This is sort of a loaded question. This might have to do with whether or not you belong to a group that is not in Alberta, so part of our private sector. So I'm going to give you my email address here, and if you could email me your situation, we can kind of figure out whether or not you are eligible or not. There's a question, what are the implications of joining if I live in Ontario? We have members throughout the country. So if you are eligible to join ARTA and you do live in Ontario, that's great. That your Ontario provincial plan, the seniors plan there, they will be the first payer in prescription drugs. ARTA becomes the second payer, and you can coordinate those two plans as well. Just as long as you belong to that plan, you are eligible. There's a question, do you need to be retired to sign up? No, you do not need to be retired. If you are continuing to work, or maybe your employer stopped your benefits, you can join ARTA. We don't care if you're still working, you can be working, but if you want an ARTA benefits plan, you can join ARTA and continue to work. We just worry about your benefit plan, your employer-sponsored benefit plan, because if you have an employer-sponsored benefit plan, you might not need an ARTA benefits plan. That's totally up to you. Oh, there's a question. How does it work when one is under 65 and the other is under 65 years of age? We go off of the primary card holders age. So if you are the primary card holder and you are 60 and say your spouse is 67, we go off of your age. So you can join a comprehensive plan or a build your own plan. So we base it off of the primary card holder. There's a question, can you talk about hospital coverage? So you are coverage for any ambulatory services that you get. We also offer private benefits. So if you can get a private room, we will cover you for $150 a day when you're in the hospital for a private room. There's a question, could you share the current premium rates for comprehensive enhanced level? I guess it depends if you are a public or private sector member. I can show you where that lives on the website. There's just quite a few situations that you can go with. So some of the rates are a little bit different. So if you go to extended healthcare and go to benefit plans, sorry, this is really slow. So this is that chart you can use when you are picking your benefit plan here. But I'm just gonna take a shortcut to our rate sheets. So if you are in our public-private, so here's the education sector rate sheet or a public-private sector rate sheet, or if you belong to a separate group here, there's rate sheets all here. But I'll go to the public-private sector rate sheet. So this is the public-private sector rate sheet. So if you were going to go to one of those comprehensive plans that I was talking about, essential health for a single is $210 a month, and a couple is $417 a month. There is a question, does travel insurance include emergency evacuation, i.e. helicopter to a remote location? Yes. The ARTA emergency travel coverage will get you out of your situation as fast as they can. We rather you be at home. So if you need to be evacuated by a helicopter, or if you are in a remote location, we will cover you and we will get you to where you need to go. Oh, if you retired effective July 1st, what process would I need to follow? So what you will need to do, I'm going to provide my email address to you as well. If you do not have a current group employer sponsored plan, and you are outside of that 60-day window, you would need to fill out a medical questionnaire, which is administered by Beneva, as I mentioned, and they are the ones that decide whether or not you can have a plan that includes travel or not. If you do not want a plan that includes travel, you can join at any time. But if you do, you would just have to fill out that medical questionnaire. Oh, there is a question. Do I need to apply before I hit 65? You can join ARTA at any age. You can be a 40-year-old that joins ARTA, or you can be a 70-year-old or 75-year-old that joins ARTA. You can join at any age. Okay, I don't see any other questions coming in. Again, if you would like me to send you an enrollment kit, just email join@arta.net and we will get something out to you right away. Thank you so much for your time. And if you would like to watch us again, you can visit our YouTube channel.